Dear audience, let me present you my PhD studies, which is about the applications of dietary fibers in patients with metabolic disorders. My name is Evelin Juhász, and I'm a PhD student at the Doctoral School of Health Sciences. My vision is to normalize the metabolic disorders of the patients by receiving dietary fiber instead of medication, and my mission is to draw attention of the physicians to the results of the studies regarding the dietary management of PCOS. Here you can see the 3 projects what we are working on. The first project goal was to rank the effects of dietary fibers on glycemic control and lipid profile in patients with type 2 diabetes. Our second project is about investigating the most effective dietary approaches in women with polycystic ovary syndrome. And based on these 2 studies results, we would like to perform a randomized control trial. Our first project title is Galactomannan is the most effective soluble dietary fiber in type 2 diabetes. Just a little background of the topic. 6.28% of the world's population has type 2 diabetes. Based on previous studies results, dietary fibers show beneficial effects on reducing blood glucose and lipid levels in patients with diabetes. But what are these fibers? Fiber means carbohydrate polymers with 3 or more monomeric units. These fibers usually classified as soluble and non-soluble dietary fibers. They have different effects on the human body. For example, they can stimulate the secretion of gastric juice, they can resist the digestion and absorption, and regulate the gut microbiome. And I would like to emphasize that using dietary fiber is a gap in the guidelines of diabetes. Our aim is to investigate the effects of dietary fiber supplementation on glycemic control and lipid profile in patients with type 2 diabetes. Our clinical question was, does dietary fiber intake decrease the hemoglobin A1C level compared to another type of dietary fiber or no dietary fiber intake? The population was patients with type 2 diabetes. The intervention and comparator were the same: soluble, non-soluble, dietary fiber, and no fiber. The outcomes were the glycemic and the lipid factors. Our hypothesis was soluble dietary fiber intake can normalize glucose and lipid levels in patients with type 2 diabetes. We did a systematic search in last year, which was updated in this year November, and on the left side you can see the plasma flow chart. This table summarizes the results for the 9 outcomes. On the left side, you can see the 16 types of dietary fibers, and at the top of the table, you can see the 9 outcomes. You can see sucra values. The higher the sucra value and closer to 100%, that dietary fiber seems to be the most effective on reducing blood glucose and lipid levels. We highlighted with red the most effective ones and highlighted with blue the least effective ones. As a conclusion, we can say that galactomannan, inulin, and beta-glucan was the most effective dietary fibers, and the no fiber were the least effective. In conclusion, galactomannan was the most beneficial intervention for hemoglobin A1C level, fasting blood glucose level, triglyceride level, and LDL level, and it has significant results in almost all outcomes compared to no fiber. Our study strengthened that this is the first network meta-analysis assessing the effects of soluble dietary fibers in patients with type 2 diabetes. It has rigorous methodology. We could assess 16 types of dietary fibers, and we could include almost 3,000 patients. We have limitations as well: the small number of the direct comparisons, the different doses and formulations of the dietary fibers, and patients had various background diets, medications, and lifestyles. As a summary, I would like to say that using dietary fiber as a supplementation is a good way to increase dietary fiber intake, and these fibers should play a greater role in the dietary counseling. Implication for research: I suggest further and long-term and high-quality RCTs, and further researchers should use effects of dietary fibers on other types of disease, which include metabolic disorders, for example PCOS and obesity. Our manuscript is accepted in the American Journal of Clinical Nutrition, which is a D1 journal. Our second project title is Effects of Different Dietary Approaches in Women with Polycystic Ovarian Syndrome. Just a little background of the topic. PCOS is one of the most common abnormalities in women with reproductive age. In the first-line treatment, lifestyle modifications include dietary, exercise, and behavior therapies. But for the assessment and the management of PCOS, currently, there is no or limited evidence about the specific dietary composition. That's why our aim is to identify the most effective dietary approach in the treatment of PCOS. Our clinical question is, which dietary approach has the highest effect on normalizing metabolic and hormonal measures in women with PCOS? The population is women with PCOS. The intervention and comparators are the different types of dietary interventions and the metformin, and the outcomes are the anthropometric, metabolic, and hormonal measures. Our hypothesis is dietary approaches can normalize metabolic and hormonal parameters in patients with PCOS. We did a systematic search in May, and on the left side you can see the Prisma flowchart. This is a summary table of the results. On the left side you can see the different dietary interventions. On the top of the table you can see the different outcomes. These numbers are sucra values, and which number is higher and closer to 100%, that dietary intervention was the most effective one. We highlighted with red the most effective interventions and highlighted with blue the least effective ones. Based on these results, we can say that the Mediterranean, the DASH, and the low-calorie diet with metformin was the most effective ones, and the least effective was the low-protein diet. Our third project is about the effectiveness of dietary fiber on the ovarian function and metabolic balance in women with polycystic ovary syndrome. The background is almost the same as I said before, but I would like to highlight that PCOS has a lot of clinical manifestations like insulin resistance, hyperinsulinemia, and obesity. And for these manifestations, women usually get insulin sensitizers, which has short and long-term complications. That's why our aim is to give for these patients an alternative treatment, which would be the dietary fiber. So our aim is to examine the effects of dietary fiber in the treatment of PCOS. About the protocol, we would include women with PCOS, and after the randomization, on the arm A they would get galactomannan, on the arm B they would get maltodextrin. And after the intervention, we will check the menstrual cycle, and as a secondary outcomes, the glycemic factors, the hormonal parameters, the lipid factors, and non-alcoholic fatty liver disease. As a summary, I would like to show you again the three projects what we are working on. And as a dietitian, I wouldn't say anything else than Hippocrates did, let food be thy medicine and medicine by thy food. Thank you for your attention.